CAR T cells are really exciting. They've definitely been a focus of a lot of this conference because they provide a really interesting and efficient option for patients with systemic lymphoma in particular. Similar to bispecifics, there were initial questions as to whether or not the T cells can effectively traffic and penetrate the CSF. So the initial trials actually also excluded patients with CNS lymphoma. But more recently, there have been data showing that actually CAR T cells do in fact penetrate the CSF. So we had about 20 patients who got CAR T cells with active secondary CNS lymphoma. And what we really found was that unfortunately, CAR T cells do not provide a long-term remission for these patients. We know that in patients with systemic lymphoma, CAR T cells, in particular DLBCL, CAR T cells can induce a long-term remission in maybe about 40% of patients. But in our particular study for secondary CNS lymphoma, that number was about 10%. So it did not yield a long-term response. And the rates of ICANS, in particular high-grade ICANS, so grade 3 and 4, were pretty high. So several patients had seizures, complications, probably due to the off-target effects of CD19. So I think, in comparing CAR T versus bispecifics, I think bispecifics are pretty interesting and neat in that they don't have as much toxicity and that they didn't have a lot of CRS and ICANS, and the duration of response was about 5 to 6 times longer than CAR T cells. So I think that there's still some work that needs to be done with CAR T cells in terms of, how they penetrate the CNS. Are there other agents we can give along with CAR T to make them more efficacious in the CNS? It's possible, but I think for now, bispecifics, for me in particular, are really exciting as a new therapeutic option.